One of my particular areas of interest is fractures of the wrist. As our population ages, osteoporosis is a greater factor with wrist fractures. People are more active for a longer period of time, and osteoporosis unfortunately affects women. The aging population and lack of estrogen, especially in women, can lead to osteoporosis or thinning of the bones. I encourage all my patients, when they reach the appropriate age, to get bone density testing to check for osteoporosis. Fractures of the wrist occur very commonly in both youngsters and the elderly. When they occur in kids, most of these fractures can be treated non-operatively. Most just can be casted or splinted in the position that they're in. If the fracture is angulated or displaced, oftentimes we could do a simple reduction in the office. In the elderly, the same holds. Most fractures are non-displaced, can be treated in a cast, or when the fractures are out of place, they can be casted and reduced in the office. A number of years ago, I made the association of a surgeon in Florida who came up with a novel technique to treat fractures of the wrist. This has now become the standard of care. I've had the opportunity to teach surgeons both nationally and overseas on this technique to fix fractures of the wrist. Prior techniques involved casting for a period of 6 to 8 weeks. Though patients oftentimes did well, the problem was that period of immobilization kept people out of work and activities. The ability to fix these fractures anatomically with newer techniques has allowed patients to get back to their activity level much faster. When the surgery is done as an outpatient, patients can usually start physical therapy in 5 to 7 days. Unlike traditional techniques of casting that require longer periods of immobilization, patients can get back to their activities that much sooner. Furthermore, the ability to anatomically reduce and hold a fracture with fixation helps the long-term outcome. Studies are now being done to compare the results of newer fracture technique fixation to older techniques. My patients have routinely found that fixation of their fractures allows a quicker return to their normal activities. I'd be happy to talk to you about the different options that you have to treat your fracture. I'd be happy to see you in the office, and we'll talk to you about the different options available to you.